We're good. Okay, so we have Ernesta in the chair. Ernesta's a lovely lady, and she has a big problem. So this is emergency dental 911 911, a 911 for each tooth. So you can see each tooth is quite mobile, and you can see when I move the tooth, this whole segment moves too, and when I move this tooth, it also moves. So both teeth are involved in this infection. You can see this giant zit-like protrusion on top of her gum, and you can see just like Dr. Pimple Popper, this is Dr. Steven Ingber Dental Pimple Popper, and you can see when I push on here, you can see the pus coming out. I'm not going to push out hard, but you can see how when we just even push a little bit, we're getting weeping, just like it's really nasty. Now the thing is, everybody, you have to understand, this could make her physically sick because all the bacteria and the dead pus and all the tissue is obviously in her bloodstream also. It's just not localized in this area there. And if it's left long enough, it can actually swell up into the fold of her jaw, up into here, go apically or go vertically up towards her nose, and go also underneath here too. So what are we going to do here? Well, we're going to put her antibiotics. We're going to put her on a rinse called Paradex. She's going to come back. I'm going to take out these two teeth, and I'm going to do what's called a gingivoplasty, which is just to alter or kind of do a plastic surgery on the gum here. So when it heals up, it'll get nice and smooth and not have all this extra tissue. Another problem that I'm going to create by taking out the teeth, we can't really add it to her upper denture right away. Can you give me your denture for a second, please? So here's the denture here. This is an easy repair, so the two teeth involved are these two teeth. So if we just put it into her mouth here, yeah, it slides pretty nice. So take out the teeth, add it to the denture, but not right away. That's not what I would recommend. I mean, there's other things that we probably could do with the denture anyways, but that will be for a few, maybe reline the denture, because there's been some shrinkage underneath the base of the denture and against the tissue. There's probably some rock here too. There is. So even though it looks dastardly, it's still doable, meaning helping her out. But this is Dr. Pimple Popper right here. You can see. This is a teenage experience here. You think you're a teenager again, picking your zits here, but this is not a. This is very serious infection. Yeah. We can see the protuberance of the infection. It's really pointing from the side there. This infection for me to handle is no problem. The treatment always works. You take out the tooth, resect the tissue, put her on antibiotics, Paradex, let it heal up 3 to 4 weeks. By the time we'll be able to fix this denture properly to the standards that I would fix it for her, I would probably wait 3 to 4 weeks. And that's it. Okay.